Thanks to a breakthrough drug, people are losing massive amounts of weight using the so-called skinny shot trending on social media. Joining us now with how semaglutide works is functional medicine expert Dr. Cathleen Gerenger. Dr. Cathleen, it is so great to see you.
It's so great to see you too, Gail.
So it's called the skinny shot. Some people call it semaglutide, but semaglutide is really making a change. It's not like a frontline warrior against weight loss.
Yes, and it's actually an FDA-approved peptide for weight loss. So what it does is that it sends a signal to our brain from our stomach, sends a signal to our brain, say, hey, you had enough food and you're good to go.
Okay, and so people take this shot, and I know that you kind of come from a new school of thought that helps with some of the side effects of nausea, where you give your patients 2 separate shots for the week, and you can't even feel the shot. They're so like a tiny, tiny little needle, and that you take it a few days apart from one another.
Yeah, so what we did at our practice is that we modified the protocol a little bit. Instead of having a full dosage, what we did was that we break the dosage in half. So we kind of modify the protocol a little bit.
Okay, and then the person doesn't feel that nausea.
No, not at all, or even the side effects of constipation. But there are some patients, when you're reducing your caloric intake, of course, your stomach feels a little bit different because it doesn't have the full volume of food that you're eating. So what it does is that it actually inhibits your body from emptying. It's called gastric emptying, so it makes you feel like you're full. So anybody that's having issues with constipation, make sure you talk to your healthcare provider or implement digestive enzymes or probiotics.
Yeah, and a big national weight loss program has integrated this into their system, and I think that's an important message to convey to our viewers, because you really do have to change your eating habits along the way. I mean, this should be an aid to teaching you how to eat right, to break these habits, so when you're on the cycles, you know, of the shots, that you can learn to eat better, so when you get off of the shots, you don't gain all the weight back.
Yeah, so we talk a lot about preventing rebound weight gain. You can suppress somebody's appetite, or you can reduce the caloric intake. You know that they will lose the weight. However, the key is to balance their blood chemistry, look at the hormonal pattern, and make sure that by the time they get off of the shots, they don't have that rebound weight gain.
So there might be places that are just doling out these shots. What you're saying is it's important to look at the patient at a holistic level, so you can find out deep-rooted what's causing this weight gain in the first place, because to your point, it could be hormones.
Exactly. And another thing that we want to look at is that if we're using it off-label for weight loss, we want to make sure that they're safe, make sure that they're not type 1 diabetic. So what we do is that we screen for their hemoglobin A1C to make sure that their sugar level is within that normal limits.
Okay, so a lot more goes into this, because, you know, as you scroll through social media and you see people looking so amazing, you're like, just give me the shot, just give me the quick remedy, which, you know, we all want. And this is definitely a quick remedy, but you want this to be a long-term play. And that's when you go into a doctor and say, tell me everything. The shot is just a way to jumpstart the weight loss.
Absolutely, and looking at your overall health, and what I'm finding out with our patients, the feedback is they're like, hey, I'm not drinking as much.
Yes, that's a big one that you hear a lot of people say. Why is that?
What it does is that it tells your liver that, hey, stop dumping that sugar into my bloodstream. So that's why they use it for diabetes as well, to control diabetes. It helps to lower the cholesterol level, and it helps to lower the cardiovascular risk, because unfortunately, when we gain X amount of weight, it's inflammation.
And that's what alcohol causes, is inflammation.
Yes.
Yeah, all right, so that's another benefit of it, because I've heard a lot of people that they cut down their drinking while on the cycles of the shot, and you do it in cycles, like you start with a lower dosage and then you build up.
Exactly. Another thing that we have feedback is that their cognitive function, it's very neuroprotective, because don't forget, when we have inflammation of the brain, what it does is that it causes a lot of mental fog. So patients are coming back and said, oh my gosh, my mental clarity is so much better.
That's incredible. Dr. Kathleen, this has been so interesting. I know it's a hot topic. We've talked about it on Bloom before, but it was nice to get it from your perspective in the medical world of how to really safely use this, and not just for a quick fix, so that you can, for the long term, keep the weight off. So, as always, we love having you on Bloom.
Thank you so much.
You're welcome, Dr. Kathleen. We're going to post Dr. Kathleen's story on our website.